大家好, I'm Nathan Rich, aka 火锅大王. You know, for 7 months I've been working on a timeline. I'll probably make this timeline available to my Patreon, Subscribestar, and PayPal subscribers. So if you're one of them and you want access to this timeline to check the sources or recommend some changes or add things, that type of stuff, please let me know. In the meantime, let's get started. February 2nd, Trump says we have pretty much shut it down, and foreign nationals are banned from Wuhan, but not American citizens. Surgeon General says risk is low for coronavirus, but high for the flu. February 3rd, CDC says we are preparing as if this were the next pandemic, but again, makes no recommendations about wearing masks or avoiding crowds or anything like that. Business Insider, masks are not helpful. CDC, do not wear masks. The HHS requests $2 billion for respirators, but is denied. Wall Street Journal says pandemic seems inevitable. CDC, we do not think that the American public should be going out and buying masks. Then we learned that it can have a very long incubation period in some extreme cases. We also find later that this was the day of the first known American death from COVID, February 6th. Meanwhile, the next day, Guardian says masks are, quote, not always useful for the healthy general public. Florida refuses to make some of its data public, citing the confidentiality of patients, which is very bizarre. And this is the same day that Trump tells a reporter that he is aware that COVID is more deadly than the flu.
It's also more deadly than your strenuous flus.
Is transmissible in air.
It goes through air.
And has a 5% death rate.
This is more deadly. This is 5%.
Aerosol transmission is indeed possible. And the COVID task force says the risk of contracting COVID-19 is minuscule. Dr. Helen Chu is trying to test patients for COVID-19, but the CDC denies her the ability to test. And she says, quote, we felt like we were sitting, waiting for the pandemic to emerge. CDC declares that these testing kits they've been developing over so much time, they don't work. The former head of the FDA warns Congress medical supply chain issues. Trump delays the U.S. worldwide threat assessment indefinitely, which was expected to warn that the U.S. remains unprepared for a global pandemic. The CDC does not currently recommend the use of face masks for the general public.
We do not have widespread transmission here in the United States.
And the CDC says this virus is not spreading in the community. Again, on the 14th, they don't make any recommendations about masks or crowds, etc. The State Department allows infected Americans into the US, causing the largest known cluster outside of China at that time. And this is against the CDC recommendations. That's February 16th. COVID Task Force Fauci says absolutely no reason whatsoever to wear a mask. And they also declared that China is not faking their numbers. The next day, February 18th, by the way, is the peak day for China active cases. Starting on this day, February 18th, 2020, every day after that was a slow decline in cases in China. So, in other words, as of this point, they have, for the most part, solved the problem. A few days later, CDC, quote, we're not seeing community spread here in the United States. And only 3 states are capable of testing at this point. And again, they don't make recommendations about masks, crowds, etc. For some reason, they say it's possible, even likely, that community spread may eventually happen. In reality, of course, community spread had already been happening for somewhere between a month and a half to 2 months. The CDC specifically tells states to test, quote, only patients showing symptoms who had travel histories in mainland China. Not that it really mattered because only 3 states could do any testing in the first place. There's a memo that says increased probability of pandemic that could infect 100 million people and could kill 1 to 2 million people. Fox says there's global pandemic fears. Harvard professor says it will likely not be containable. Meanwhile, Trump says that coronavirus is very much under control in the USA. Dr. Helen Chu finally just tests the patients against the government's support and surprise, they have COVID-19. And this is the first day that the CDC actually sends a public warning to Americans to prepare for an outbreak. February 25th, more than a month after the first known case at that time, the CDC also warns that disruption to everyday life may be severe. But they also don't make recommendations about crowds or masks or anything like that. Meanwhile, Trump praises the CDC. He also says it's very well under control in our country. And someone from the White House says, we have contained this. Meanwhile, 1.4 million people crowd into New Orleans for Mardi Gras. Next day, Trump says cases are going to be down close to zero. And in some ways that's easier, and in some ways that's a little bit tougher than seasonal flu, whatever that means. And also that we're very, very ready for this. And the risk to the American people remains very low. And speaking of travel restrictions, he says, right now, it's not the right time. Here, recommendation is you should only wear a mask if a healthcare professional recommends it. And Slate says silent spread might be a good sign, presumably because the death rate would be lower than we suspected. And this is the day that my video came out about the H1N1 and what would happen if the coronavirus hits the United States. And then they changed the very strict testing requirements to also test for cases from Iran, Italy, Japan, or South Korea, but still with symptoms or direct connections to known cases. So still way too strict. WHO says the global threat is very high. FDA reports drug shortages. PolitiFact, masks are only needed if you're sick. And CDC, again, doesn't make recommendations about masks, crowds, etc. So by this point, we are positive that the virus is in America, that it's spreading, that it's human-to-human transmissible, that it's a high risk. All this stuff is happening, that we can't test, all these things. And this is the day that the Surgeon General of the United States of America says publicly, seriously, people, stop buying masks. And the Vice President of the United States of America in the 21st century tells people not to buy masks during a pandemic. The COVID task force, no need for behavior change. CDC, again, doesn't make recommendations about masks, crowds, etc. But the FDA begins loosening testing restrictions for unapproved testing methods, which is actually good. A study says that deaths were being underreported by 28%. A New York doctor reports having to beg to test. Surgeon General, masks can increase a person's risk of contracting COVID-19. This is absolutely crazy.
Stop buying masks. That's the request from the U.S. Surgeon General.
The best way to protect yourself is by washing your hands regularly with soap and water.
Sounds so simple, but that's what they're telling us to tell you.
CDC, again, doesn't make recommendations about masks, crowds, etc. HHS says the U.S. has only 1% of masks needed for pandemic, which is quite strange because if we believe any of the other stuff they've been telling us, we don't need masks. In fact, we should probably just be burning masks because they only make things worse. The CDC widens the test criteria, finally, so that you only need a doctor's approval to get tested. However, there's still not enough tests anyway. People are getting conflicting advice on face masks. The vice president tells the public there aren't enough tests.
Working in partnership with our commercial labs, we're confident that we're going to be able to address that within a matter of weeks and begin to distribute coronavirus tests much more broadly across the country. We don't have enough tests today to meet what we anticipate will be the demand.
And the New York mayor does not recommend changing behavior. PolitiFact says only people who are infected or caring for someone who is need to wear a mask. Meanwhile, the Coronavirus Preparedness and Response Supplemental Appropriations Act is enacted. Trump says anybody that needs a test gets a test. And at that point, there had been about 10,000 tests in the entire country. The next day, the government is reported to be debating how, quote, far to go in telling Americans the truth. And March 9th is the first time that all 50 states can test. And Fox says we still don't have the testing. The CDC says, please fight the urge to buy a mask. And we really do not think this is the time for Americans to be going out and getting masks. And they make no recommendations about avoiding crowds unless you're older or you have an underlying illness. 2 days later, the global pandemic is declared, and America expands some of the travel restrictions. Trump, meanwhile, says the risk is very, very low, and the CDC admits that they've misdiagnosed COVID deaths as flu deaths, but they offer no details such as how many, when, where, nothing. The next day, Johns Hopkins estimates that the CDC is reporting only 0.3 to 3% of the cases. USA Today says there's no clear CDC tracking, there's limited transparency, the CDC neither publishes nor collects comprehensive data, no one knows how many Americans have been tested or are infected, and it is really hard to understand why they haven't been prepared. The next day, Ohio estimates that it has up to 100,000 COVID cases. Meanwhile, the CDC reports that Ohio has 5 cases. Trump orders a national emergency, and the FDA approves a commercial COVID test. The HHS says supply chain and transportation impacts will likely result in significant shortages, and the New York Times says 1.7 million people could die. Still widespread large gatherings, and the CDC just stops tracking testing on this day temporarily. There's an expansion of travel restrictions, and cruise ships stop sailing. On March 16th, a study says 2.2 million US citizens might die from COVID. Social distancing guidelines get enacted. Avoid groups of 10 or more. Some studies say that if this were done 2 weeks earlier, it could have had a 90% reduction in cases, although I disagree with that because this is already March 16th, which means it's been, by this point, already months that the virus has just been spreading in the United States without almost anything at all happening, other than them telling you not to wear masks and don't worry about large crowds. The Atlantic says that cases are in an exponential curve. Also, the family's first Coronavirus Response Act is enacted. U.S. active cases surpasses China. Trump tells a reporter that it's dangerous to young people.
Now it's turning out it's not just old people.
And I wanted to play it down. I still like playing it down. I don't want to create a panic.
I wanted to always play it down. I still like playing it down because I don't want to create a panic.
Wall Street Journal says that in regards to testing, the government has failed, and there are widespread beachgoers. Wide travel restrictions for non-Americans are enacted on the 20th. Atlantic says the government dramatically misunderstood what was happening in America as the outbreak began, although evidence suggests that they knew quite well what was happening. New York Times, the government, quote, not providing national rationing guidelines for the coronavirus outbreak, and the White House pushes U.S. officials to criticize China. 23rd of March, USA Today, masks are ineffective. WHO warns that the pandemic is accelerating. People are partying to intentionally violate restrictions. Forbes calls the CDC negligent, and Trump encourages full churches. It's reported that states are underreporting tests. The United States becomes the #1 in cases, and Trump says, you can call it a germ, you can call it a flu, you can call it a virus. You know, you can call it many different names. I'm not sure anybody even knows what it is. And the White House predicts deaths to stop in June. The CARES Act is signed, GM is forced to make ventilators, and it's revealed that the US has been sitting on 1.5 million N95 masks that are expired but deemed safe to use. The next day, CDC reiterates, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. The next day, LA Times says groups are causing spread and deaths. Hospitals and volunteers are crowdsourcing masks in the middle of a pandemic in the United States of America. Scarcity of ventilators has become an emergency. Companies are hiking up mask prices markedly. Here's a warning that up to 240,000 deaths may be possible. There's mass confusion about masks, and AP repeats not to wear masks. CNN reports Asia may have been right about coronavirus and face masks. LA Times, face masks could provide coronavirus protection. And the White House Coronavirus Task Force is, quote, missing 50% of their testing information. Somewhere around this time is when the amount of deaths from COVID was about half as much as the amount of seasonal flu deaths worldwide in the same amount of time. CDC recommends Americans wear face masks voluntarily in public. And they recommend, quote, consider wearing cloth face masks. They also release guidelines on how to make face masks out of coffee filters. Meanwhile, 13 states still have no lockdowns at all. Fauci says he doesn't understand why states aren't issuing stay-at-home orders. The government is reported to have stolen 200,000 masks, and Trump says he will not wear a mask. White House predicts deaths will stop in May. Meanwhile, the former HHS secretary says we wasted 2 months by not ordering masks sooner. New York Times says up to 2/3 of the deaths are unreported, and they also say rampant falsifications, errors, and issues with case reporting. Another report, massive death underreporting. CDC director downplays the coronavirus models. Nature says that thousands of coronavirus tests are going unused in US labs, and there's a lack of national strategy that's largely to blame. Trump says mass testing is not needed, and Fox reports that some states are pushing back against CDC guidelines. Americans are scamming each other, faking 39 million masks, for example. There's a testing backlog which is vastly underreported, up to 50%. United States becomes number 1 in deaths. And around this point is when there were as many deaths as seasonal flu. And then there's deaths in all 50 states. Forbes reports that there are deceased elderly people who are going untested, and Stanford professor says there are orders of magnitude more people that have been infected than are being reported. Widespread protests against masks and policies begins.
Hundreds of protesters defy the state stay-at-home order and line the streets in front of the state capitol.
Nurses are being fired for refusing to work without masks. State reopening plans begin. Trump encourages protest against governors who have imposed virus restrictions. And New York Times says that sloppy CDC practices have caused contaminations and delayed test kits. And then some states begin undoing their stay-at-home orders. All right, let's stop here and not go too much further so we can break this video up a little bit. Again, if you want access to the timeline to check out the sources or contribute to it, please do so by joining my Patreon, Subscribestar, or PayPal, and let me know. Until next time, thanks everybody. 谢谢.